Are there some topics that you really wish you could discuss with your doctor and they just don't come up? Or when they come up, you feel kind of awkward about it? Well, if it's related to perimenopause and your health as a woman, then there are probably some topics that you have not discussed with your doctor and you would like to. This episode is with a medical doctor, Mikala Albertson, where we sit down and talk about some of those things and talk about her upcoming book where she goes into those in even more depth. And so as you come on in, I hope that you are as eager as I am to hear what Mikala has to say about perimenopause and the changes in our bodies and how we can plan for our best health. Welcome to Midlife Repurposed. If you're craving inspiration, practical tips, and a renewed sense of purpose, you're in the right place. Here, we embrace the messy, uncertain, and sometimes downright challenging turns of midlife with a dose of humor and an unwavering belief that there's treasure to be found even in the tough stuff. I'm your host, Michelle Rayburn, an author who's passionate about uncovering hope in the most unexpected places. Let's repurpose this season of life together. Today I have a guest. Her name is Mikala Albertson, and she's been on the show before. Today we're talking about a different topic, and I'm so excited to have her here. So I want to give you a little bit about Mikala, and then we'll jump into the conversation. Dr. Mikala Albertson is a board-certified family practice doctor. She's an author and well-being advocate who is passionate about women's health and healing in the imperfect bodies we actually have. She's the author of the book Ordinary on Purpose and inspires readers every day to stop striving for perfect lives or some unattainable cultural ideal of beauty and wellness, and instead aim for wholehearted living through a gentle, achievable, sustainable approach. Today we're going to be talking about perimenopause. I'm going to be talking about women's health and Mikala's new book that's coming out. And we're tying this episode very specifically to the book because it is such a practical resource for women. Before we get into the episode, I just want to give a disclaimer about the content. This does not replace consulting your doctor for advice. This interview is for discussion purposes and for learning, and we are each responsible to evaluate the information and discuss it with our doctors. So our conversation today that I have with Mikala is general medical advice. It's practical info that we can discuss. The same with her book, but we always are wanting you to go and discuss it with your medical doctor. These are springboard points for you to take some notes and then put them into practice in your own medical care plan with your own team. I could have chatted with Mikala all day, but we had to stop somewhere. So this is the segment of our conversation that you get to hear, but I encourage you to get her book. I'm going to have the link in the show notes, and there are some incentives for ordering right now because it's still in the pre-order phase for one more week. So I'll give you that at the end of the show. But for now, let's jump into the conversation with Mikala. Mikala, welcome back to my podcast. It's now Midlife Repurposed, but I'm super excited to have you back here.
Well, I'm so excited to come back and visit with you.
So the last time you were here, you told a lot of your story and you were talking about a book that you had released. Is it Ordinary on Purpose? Is that the...
Yes.
Wow, yep. I had to pull that off the top of my head. It's not in my notes. I should have had it there. So you really told a lot of your story there, and you had really practical applications for the reader, but it was also a really vulnerable and raw book. And I really resonated with that. And so I think I just connected with your writing style. So then when I saw that you had a book on midlife coming out and you were blending with teaching as a medical doctor, I was like, I have to have this. So I'm super excited that we can talk about this today.
Yeah, awesome. I feel like this project for me has been like a marrying of my two loves. I love writing and I love storytelling, and I loved seeing women in clinic and working in medical practice. And so it's those two things coming together. I kept going back as I was writing and thinking, this really is everything I wish I could tell you. It's the book I wish I could have handed out to patients all these years to say, take this with you, please.
Yeah. And one of the things that I always have in like my podcast notes for prospective guests is I say, we're not here to promote a book. And the thing is, we are here to promote a book, because when a book comes out that really resonates with me and the content is speaking directly to my life, I I'm going to plug that book. So I'm super excited about plugging this book. I'm going to talk about it right off the bat here with the title, Everything I Wish I Could Tell You About Midlife, A Woman's Guide to Health in the Body You Actually Have, which is really key. So before we get into talking about that, Mikala, I know you've had some changes in your life, in your own midlife. So what's new since the last time I chatted with you?
Well, I think the last time I chatted with you was a couple of years ago.
Mm-hmm.
And so in my career life, I have officially quit my clinic job. I don't know if you know that, to say that I'm authoring full-time now. And so I am really still kind of trying to come to terms with that adjustment. I think it's been great.
Mm-hmm.
So I have 18 years of clinic experience and I love writing. And so I just thought I'd make this jump and I jumped right into this book from there. So I also
That's exciting.
Yeah. I also have a whole bunch of teenagers now and I'm 45 and I am right in the middle of midlife. And so I think I'm right in the middle of all of the transitions that I'm writing about in this book, maybe early into some of those transitions because I know there's more to come. But yes, I have 3 teenagers now, one off to college, and I have a tween and still an 8-year-old little girl. So I'm kind of in a lot of life stages at once, which is what midlife is about, I think.
It is. And for the listener, I'm 55 and I am past the official day where I was declared in menopause by several years. And today I wanted Mikala to specifically talk about one of the topics in her book related to perimenopause, women's health in midlife, and some of the questions that we have. I know that for me going into it, all I had was my mom's story and a few friends, and mine didn't look like theirs. For the listener out there, my mom had ovarian cancer and had a hysterectomy at age 47, I think. And she was just starting some of those perimenopausal symptoms. She is a survivor of like 30 years now of ovarian cancer, but I don't have anything to go on from her story. So, Mikala, I'd love to know what are some of the misconceptions that women have about midlife perimenopause, kind of that right where you're at 45.
Sure. Well, I think it's changed a lot in the last couple of years. And even as I started on this book, when I was talking with some of my girlfriends about this, they wouldn't have known what perimenopause was necessarily, or they certainly didn't think that it applied to them. And now, 2 years later, I feel like perimenopause is almost like a trending term because we're hearing about it a lot, and we're hearing about it a lot in social media. And I think that marketing has sort of jumped on this lack that we've had for many, many years, and they're starting to sort of sell us a lot of things. And so now where we didn't really even think about perimenopause before, I think women are just as confused because they're like, oh, should I be taking that supplement? Do I have to be on hormones? Or, what's the right diet plan or all these things? Because now everybody's talking about it and telling us a million different things that's going to solve this problem for us, right? And so I really just wanted to kind of, in this book, talk about the background a little bit, give a little bit of the science. Hopefully the science is really easily digestible in this book, but then it sort of lets you think about your own body and your experience and your genetics and how it went for your mom, if you know that story. And then you can take it to your provider and decide together what to do rather than kind of relying on like an Instagram video or something like that.
Yeah. People didn't talk about it much. It was kind of like when I think about, I was probably, it's probably in the early 80s when I had my first period. And people were like not discussing it. Like I was one of the first people in my class. And so when I had to sneak out to use the restroom during the day, it was like we even hid our feminine supplies from our classmates. Like, I don't know why. It was so private. And I feel like I carried that same thing into all the conversations, like whether it was PMS or you talk about PMDD, premenstrual dysphoric disorder. And now into perimenopause, when I started having those symptoms, it was like, well, can I tell my employer that I really need the day off because I feel like I'm
Yeah.
gonna need to be in the bathroom every hour today. So I
Right.
love that you're addressing that shame factor as well.
Sure. I actually have the privilege of getting to talk with kiddos at an elementary school in our area. And so every year, fourth or fifth grade, sometimes they
Mm-hmm.
combine the fourth and fifth grade. I get to go and give a little talk in the spring. That started when my kids were at that school. And so much to their embarrassment, I showed up and talked about puberty with their classmates. And now I've just kept going, even though they're not at that school anymore. And they have a lot of questions and they want to
Mm-hmm.
know, and they're actually happy to talk about it. They're super embarrassed and they dread
Mm-hmm.
the day and they giggle and,
Mm-hmm.
but they actually have really good questions. I hand out like a little piece of paper that they can write anonymous questions, and then everybody hands them in and I address them all. And then I write down questions of my own that I'm answering for them
Mm-hmm.
just to make sure that we get to it all. And they really want to know. And I do hope that it makes them feel less ashamed. There's no reason to feel ashamed about puberty, just like there's no reason to feel ashamed about PMS or perimenopause symptoms. But for some reason, we kind of are. I don't know. Um, so I love doing that for them. And I just feel like, why don't we have a perimenopause class? Why don't we have a menopause
Yes.
class? Because we kind of talk about it with a mom or sister or, maybe a little bit, but we need like a class. So that's how I went through it in the book
Yeah.
is I wrote down questions that I think are common questions. And then I tried to address those questions just like I would with my kids in the classroom.
That's so great. And you going live to do it is so much better than those awful videos that we watched. It
Yeah.
was actually
Yeah.
a slideshow when I was a kid.
Yeah.
It wasn't
We
even a
do.
video.
We do watch a video first
Well,
for kind of
yeah.
some of the embarrassing things. And
Yeah.
then after that, I kind of go through like the highlights of that video. And I say, you know
Yeah.
what? Giggle and laugh if you want. That's totally fine. Don't get crazy. But we don't have to be embarrassed. Let's just talk about it. And
Mm-hmm.
it's fun. It's a lot of fun to get to kind of lay that groundwork for them. I hope their perimenopause experience is much different after all those years, right?
Yeah, I remember putting something out on social media when I was really struggling with the really heavy periods that I experienced, and there were some times when I was on the job where we had to go to like a groundbreaking or something. I was in marketing, and I knew that I was going to be out on a field with a porta potty for like 5 or 6 hours during this
Oh,
time, and I'm like, what am I going to do? I mean, it's like. Just a little side note here before we go back to the discussion between me and Mikala. I didn't explain why I put something on social media, but what I had done was put a post out saying something about women needing to take time off sometimes because of the symptoms they have around their periods. And I remember seeing a response from a man who had said he would never hire somebody if he knew they were going to take a day a month off for that reason. And I just wanted to pop in here because there is this misperception sometimes about what's going on, and it can be very debilitating. And so now I go on to continue with explaining to Mikala exactly how it affected how I coped with the work that I was doing at that time. What am I going to do? I mean, it's like, we're literally groundbreaking. So I was like wearing rain boots and that kind of thing. And I was
oh
like, okay,
gosh.
the best I can do. And this is like, I had to buy incontinence pads and I
Oh,
had to wear maxi skirts. It was like when those came in, I'm like, oh, this is so great because I can wear shorts under a maxi skirt
yeah.
and I can be confident that I can walk around. It was really uncomfortable. I had a lot of cramping and stuff with that too. And one of the things that I realized during that time was that the PMDD, the premenstrual dysphoric disorder, we call PMS, I guess. Is it the same thing, Mikala?
So PMDD is kind of a severe form of PMS. I
Oh,
think,
thank you for clarifying that.
yeah, many women have PMS. And then there's like this percentage that have kind of that next level where they feel like, I cannot do this every month. I don't like who I am during that time. It's a lot of the
Mhm.
mental symptoms more than anything. And I describe it as rage, this just unexplainable rage. And they're like, I don't know why I get this way, but I do. And it's
Yeah.
terrible. And I hate it for my family and for the people I'm around. And so there is some help for that.
Yeah. And for me, I think, with social media and things now, we tend to self-diagnose with all kinds of things. So, similar to how somebody would say, I have OCD because they like things neat and tidy or something.
Yep.
We sometimes could do that. I could see with the descriptions you had that I definitely had some of the symptoms of PMDD. The like unexplained emotions. Sometimes it was anxiety. Sometimes it was anger, lashing out at people. And so it was really hard in perimenopause to have this feeling as if I was having that all the time. Because I was having bleeding constantly. It was like every couple weeks it would stop and start and stop and start. And it just felt like this constant PMS kind of a feeling. It affects your job. It affects your ability to relate to your family. So tell us a little bit about how that works in perimenopause and how somebody can help to manage that.
Yeah, sure. So menstrual irregularity is kind of the hallmark symptom of perimenopause.
Mm-hmm.
So at some point in perimenopause, almost everybody has the menstrual irregularity, right? And so early in that transition, a lot of times the length between cycles shortens. And so it's like, man, I have a period practically every 3 weeks. That's a pretty normal thing that happens early in the transition. And bleeding can become a lot more heavy. And so I talk about that in the book. Like suddenly it's almost like you're in middle school again and you're thinking, well, am I going to bleed through and have blood on my pants? How embarrassing is that?
I can't buy white pants for a while.
Yeah. So it's exactly what you had to go through on your job. And then later it can be that those cycles lengthen a little bit where you have a little more time between periods, or you might even drop a cycle here and there. And then eventually when you drop a couple cycles in a row, it's likely that you'll have your final menstrual period within a few years. So it does kind of follow that journey. And so we're hearing a lot about all the different things that we can do or take. I do think hormones have been an underutilized treatment for women. And there's lots of different forms that comes in. And so for you and in that early transition, sometimes a birth control pill is a good idea because you're still having regular cycles. They've just changed a lot and become kind of unmanageable. And so the birth control pill can suppress your body's natural ovulation and sort of take control of those hormones a little bit. And then later, when you're starting to drop periods or you're having kind of more sporadic periods, it's likely you're not ovulating anymore. You're just having these irregular cycles. And that's where menopausal hormone therapy comes in. And it's actually a smaller dose than what you would get in the birth control pill generally. So I think that's where you go in and talk with your physician and say, I'm starting to have all of these symptoms. What can we do? So menopausal hormone therapy is one of those options. And it sort of depends on which symptoms are bothering you the most. So some women are like, I can actually manage the menstrual irregularity, but it's the hot flushes that I'm having all throughout the day and waking me up at night, in night sweats, and I'm not sleeping. That is the worst thing. So if I could manage that, I think I'd be a lot better off. And so then we use different therapy or different medication for that if we need to. Yeah.
I'm fortunate enough I go to a self-pay clinic, an independent clinic, and I'm fortunate enough to have a medical doctor who will spend 45 minutes to an hour at an appointment. Great. And so we were able to discuss a lot of things. And we tried different things, like taking one type of birth control pill for a while that helped control some of the symptoms and then stopping that one when it wasn't doing that anymore. And the final year and a half, I think was probably the worst because we wasn't able to manage it with what I was doing. And it was kind of okay, we're just going to have to wait and see. I had gone 9 months without a period and I was like ready to celebrate. I was like, I am so sure that at last. And then all of a sudden these symptoms came and I had this fullness feeling and I was like, I think I ovulated. I have very clear symptoms. I know when I ovulate. And I had this breast tenderness and all these things where I'm like, what is happening? And then I went to finally get the ultrasound that revealed that my uterus was like hyper thick. It was if it could be an overachiever, it was. So I had to have a DNC and have a fibroid removed with that procedure. And I just remember praying that would be the last, like that was the last of the last. And the doctor I saw for that did this little progesterone challenge with me where she
Mm-hmm.
had me go for a certain number of weeks, take the progesterone. And then she said, if you don't have any bleeding after these 3 months, we're going to be, and she was so right. And I was so relieved that was like the last hurrah was this. It wasn't a pleasant experience. I was really glad to get past it.
Yeah. Well, I think it's important to point out that just like puberty is kind of different for every girl, the perimenopause experience is different for everyone. And that is so frustrating and so annoying. And so I've tried to write down what to expect. But the main thing you can expect is that it's pretty irregular and erratic. And it's probably going to be different than your friend's story or someone else's story. And so it is kind of a frustrating time. And then maybe something's working at the beginning with controlling hot flashes or something. You're just taking something specific for that or certain symptoms. And then as you move further toward that final menstrual period, like you said, something else may come up. And so there isn't really anything we can give to just fix the problem. We're just going to make it so you don't have these symptoms. It really is a little bit of trial and error, and maybe what was working for a while, we got to do something different a few years later. And I know that that can be so frustrating. So, and coming back to some of the marketing and some of the things we hear, I think we're offered the promise that if you just took this, or if you just took that, or if you were just on this, it would fix these problems. And unfortunately, that just isn't how the human body works. And so more than anything, how wonderful that you have a provider that spends that much time with you so that you feel like you have a partner along that transition.
Right.
To sort of figure it out as you go together.
Yeah. And she did a good job of collaborating with the doctor I needed to see for that DNC and all of that too.
Yeah.
And so it was like, layers of care. And for the person listening, if you don't have that, I encourage you to continue looking for a medical doctor who will have the conversations, because it is frustrating if everything's kind of lumped together. Sometimes symptoms are missed that are not even related to perimenopause. And so it's good to have those open conversations. I remember the doctor that I saw. Oh, and I do want to say for the listener, Mikala does a really great job in the book of covering hormones and explaining, we won't get into that here, but what are the different hormones and how they balance out and why estrogen works one way and progesterone and testosterone another way. And there's other hormones that I didn't even know about that you discuss in there. But I had a medical doctor who kept asking me, what are we going to do about your symptoms? I'm like, which ones? And she said, your hot flashes. And I said, I've never had them. I mean, I had one with a glass of wine once, but I don't and she said, you're sure? And no, not everybody has those. So and I had to tell her 4 different visits. I had to say, I'm not having hot flashes.
That's not the problem for me. My problem is this other stuff. I thought it might be nice to kind of go through some of the variety of symptoms that you can experience in perimenopause. So we talked about the abnormal menstrual bleeding being kind of the hallmark symptom. We've talked about hot flashes and night sweats. Sometimes those can come with an irregular heartbeat that can be really scary for people. So palpitations can be a symptom of perimenopause. Certainly it can be a symptom of other things too. So we have to keep that in mind. Many, many women complain of weight gain during this midlife transition. I think that's really multifactorial, but it certainly is a bothersome symptom.
It kind of moves around. Mine all kind of moved up to the middle.
Yeah, kind of to your middle part. So your body's just overall shape or composition changes a little bit. We talked about trouble with sleep. Sometimes that's due to hot flashes. Sometimes it's not. The one that I hear a lot is, now I wake up at 4 a.m. and I have no idea why. Like I just have this new, very early wake time and there's no real reason for it. So that's annoying also. Acne can become a problem, changes in your hair texture or hair loss, a lot of vaginal changes, so thinning of that mucosa. That mucosa is really dependent on estrogen, and so as estrogen declines, the mucosa can thin, and that can lead to urinary tract infections. It can also lead to vaginal dryness and sometimes pain with intercourse. Joint pain and stiffness is really common during this time, and then also like itchy skin, itching in your ears, ringing in your ears. And so Doesn't that hit a lot of organ systems?
It's like, yeah.
It really does, right?
And they all kind of affect, because if your sleep is disrupted, it affects your mood, and that affects something else. And so, yes, thank you for that, because that also reminds me of some of the things that I did have questions about with my doctor.
Mm-hmm.
And the brain fogginess was one that, it's not just memory. It's like just moments where I feel like my brain just needs a little break.
Yeah. Or I will now say often to my kids or my husband, like, I'm going to need you to remind me of that, because I don't really feel, just, can you bring that up again, to me later? Because I don't feel like I'm going to remember that. So
yeah.
The other thing I wanted to say about that is I do think, because women's health has become this conversation and perimenopause has become this conversation, is that it is important to remember that other conditions can cause some of these symptoms.
Mm-hmm.
And so I worry sometimes, because we're having this so much, that we get tunnel vision focused on women's hormones.
Mm-hmm.
And we forget that there are other things that can cause heart palpitations or fatigue or, any of the things that I mentioned. And so I don't want to miss some of those things that can be a big deal or that need totally different treatment, which is why I think it's important to do this along with your provider and sort of rule out those. It's not a thyroid problem. It's not carcinoid syndrome. You don't have lymphoma or, any of those other things. So sometimes I like to say that perimenopause is a diagnosis of exclusion. If we've said, hey, you're having some of these symptoms, let's make sure that we're not missing something over here before we dive into how are we going to treat your perimenopause.
I love that approach, because it helps, as one of my friends describes it, helps the patient to not feel gaslighted.
Yeah.
As if, like, oh, it's just perimenopause. And
I do think people hear that a lot too. Like, well, I had all this blood testing and they said nothing's wrong.
Right.
I think people hear they said nothing was wrong with me. And I think that whenever I'm doing that testing, it's for reassurance. And so now we can comfortably say, okay, I think this is perimenopause. What can we do about it? It's not that nothing is wrong. It's just that we don't need to do this particular treatment for your thyroid or something else. Let's focus in on this issue.
It was helpful for me to have those labs done, because during that time, there was a couple of years there where I was having such heavy bleeding that my iron stores were at the bottom of the normal range. So I was cold all the time. I had signs of anemia, but I wasn't really anemic. It was just I didn't have any backup. So when I would have the heavy bleeding, then, we did do some other tests, though, to make sure there wasn't another reason. We looked at all the labs to make sure that my iron wasn't low. We didn't want to write it off as just the bleeding. But amazingly, I took a supplement for a little while in there, and then I haven't had to take it since being in menopause. My iron is perfectly normal now, with no change other than I'm not bleeding anymore. So that was also reassuring to me that we had checked on some other things, and I'm not cold all the time now like I was then either.
Yeah.
So you cover some things related to women's health. You do talk about supplements, and I will admit that when I was in the place of feeling like we can't quite figure out what we should be doing now, I think I'm just going to take all the supplements my friends told me I should take, the topical creams, the whatever, trying all these things. And I think it was just a placebo effect. I think it was just making me feel like I was doing something. Yeah. So you cover supplements, and I think it would be helpful to have you give a little summary of your thoughts on that.
Sure. Again, I think it's tricky. We want something we can do, right? We want to fix this problem, and we want something we can do. And sometimes we hear like, oh, this was so great for my friend, or this, I'm taking this and it's great. So I just talk about supplements with a little bit of caution. The supplement industry is huge. And the other issue with the supplement industry is a lot of times they don't have quite the same testing. And those supplements, you'll see on all of those supplements, this is not FDA approved. It's not meant to treat or diagnose or cure any problem. Like that's like their disclaimer that's on there. And so Yeah, I just try to talk about it in a really rational way. Like, why are you taking that? What does it claim to do for you? And is it doing that for you? The other thing is, has its efficiency been tested, and has its safety been tested? And so, gosh, that's a hard one for me to talk about because I know a lot of people are going to have a lot of feelings about that.
Mm-hmm.
But
Yeah.
I worry about putting all of those in and just assuming that they're safe and it's not going to do anything because it's a natural supplement. There can't be anything that goes wrong. But if something potentially can cause benefit, it can also potentially cause harm. And when we're putting all those things in, that is really putting a lot of tax on our liver and kidneys,
Yeah.
which are the filters for our bodies. And liver failure from overuse of supplements is a real thing. And so I just like to talk about it with a little bit of caution.
Mm-hmm.
And I tell the story in here about a gal who had just the most amazing list of supplements that she was taking. And she couldn't, I think it's one of those snowball things like, oh, I just take that. I don't even know. I don't know why I take that. Or someone told me it was good for me. I'm not even sure why. So I just have some intentionality about what you're taking and why. And I do encourage people to list it on their list of medications.
Mm-hmm. I do that.
It does matter. And it can interact with your other medications and it can cause side effects just like other medications. And so we have to be smart about the ones that we're taking. So I really have just 4 that I recommend in the book that has good safety and efficacy testing and I think are beneficial for
Mm-hmm.
women. And that is calcium, vitamin D, and omega-3, and fiber. And you don't have to take a fiber supplement, but just making sure you're getting an adequate amount of fiber in your diet is great. If you're not doing that, then go ahead and take a supplement if you need it.
Yeah, I have cut back on a lot of the supplements that I was taking. I do take the ones that you mentioned, but I actually cut out my multivitamin because my liver enzymes were elevated just slightly. And I was like, nothing else has changed, but I do take a lot of supplements. So, it's got all these, it was one of those that had so many extra things added in. So we'll see when I go back for my next lab on if it's changed it.
I do think that a multivitamin is great if you need it. Like maybe you have an absorptive issue or, you have a particular diet that you're following that really leaves out something. But for the most part, we can get what we need through a really well-balanced diet. And the other thing that I'll say is I really encourage people to stay away from proprietary blends. That kind of means this secret recipe. And so we actually don't even really know for sure what's in there.
Yikes.
And we certainly don't know the dosing that's in there. And so those would be the ones that say like ovary support or thyroid support or memory support. And then because it's a blend of things that we don't get to know what's in there, it's not a single ingredient supplement that you're taking. Those can be the most concerning for me and then tend to overlap with other things you're taking. So maybe you're taking a multivitamin and then you're taking a thyroid support. And if you're getting like super therapeutic doses of certain things.
Right.
Which can be dangerous for you.
Yeah, I did realize that, like the multivitamin has also the vitamin D. And so, I was taking a little more vitamin D than I needed to. So yeah, that's great advice. You also talk about mammograms and breast exam. And that was some things that had changed for me too. I was really surprised to find out, we're heading into October and that's a month where everyone talks about getting mammograms and doing self-exams. And you had said that was it the mammogram that's now the more effective than doing the monthly self-exam?
Yes. So mammogram is the definitive screening test. That's what we recommend. There are other things out there. Some people will promote things like thermography or things like that. Mammogram is still the gold standard for your evaluation of your breasts. And then if that is abnormal or you have very dense breast tissue, maybe you would need an MRI. If they see a nodule or they see something that's concerning and they want to see whether it's a cyst or something solid, you might get an ultrasound. But mammogram is the definitive test. It doesn't mean that you can't do self-breast exam or you shouldn't do self-breast exam. It just means that it's not really finding what we're hoping it will find. and it tends to cause people a lot of concern.
Yeah.
Because if you feel on your breasts, they don't feel super smooth, and that changes over time as we lose fat in some areas and the fibrous tissue changes. And so, yeah, we're not saying do that self-breast exam every month. You have to do that. It's actually not even recommended necessarily. And if you're going for your mammograms, that's the best thing that you can do.
Yeah, so this is important. Like Mikala is sharing general medical advice. And just like I have the disclaimer at the beginning of the show, she's sharing the standard recommendations. This is not just Mikala's advice. This is, it's surprising how it's changed, how often you should get a mammogram or how often you should have a colonoscopy and at what age these kinds of things start.
Yeah, that's the other one that has changed. I think everyone had 50 ingrained in their brains for colonoscopy, and those guidelines have changed. And so now it's at 45 that we recommend doing that. So yes, this is kind of the current recommendations from all the different societies. And if you went into your doctor, these are kind of the current guidelines. It's important to note that those things change. And isn't that annoying and frustrating? Like, why does it change? But it's because we're always doing more research and there are always studies, and we're always trying to improve on what we didn't know before, or what aren't we getting right, or what were we telling people that, isn't correct. And so sadly, this book might be, maybe I'll have to do an updated version in 5 years from now or something where, we're doing this a little bit different now, or we have this new test for, whatever it might be that we're doing. So it does change, which is why I always encourage people to go for their yearly checkup. I think yearly checkups at 40 is a great way to just get started, because then you're going to always get the current recommendations and be up to date.
Yeah. Even how often to have a pap smear has changed.
Yes.
And I think the last time I had one, it was the combo, the HPV and pap smear, which also changed the window then between them.
Yeah.
So that it's good to have those discussions with your medical provider, because they can explain based on your own history, whether you're high risk, whether you should have one more often, or whether you should follow the standard guidelines. So those are conversations that we definitely want to have. For the listener out there, if you have not had a mammogram, or you have not had a regular physical with even some labs, or you've not had a pelvic exam and a pap smear, I'm going to tell you to go ahead and schedule your appointment, because it's always good to know, rather than to think if I'm going to wait until some symptom comes up.
For sure. That's why we do screening tests. So I talk in here like, why don't we screen for everything? How do we only pick up some of these things? Well, we have really good ways to identify early disease for certain things. And that's why we recommend these screening tests. And then for other conditions, either it's not common enough, or we can't catch it in an early stage to do anything about it, or maybe we don't have the correct screening test for it yet. It's been interesting. I had this conversation with just some of the other moms on the soccer sideline, and they're like, I take my kids to doctor appointments. Right. I know when my kids need sports physicals. I went to the doctor when I was younger because I wanted birth control or something. So I was real great about getting my pap smears, because they used to make you get it every year just to get your, birth control or whatever you're doing. And of course I went during my pregnancies, but like, I don't even know when I'm supposed to go to the doctor in my 40s. And so I do think it's really good practice to just go, I would say at least every 2 years, but once a year is great. Most insurances will pay for that preventive exam, or for most of that preventive exam.
Yeah, I've talked to people that have waited 5, 10, 15 years and have not gone, and it's like, well, this is something we do for ourselves, and we do it for the next generation. I have 4 grandchildren and more on the way, and I do it for them. It's like they want me around for a while too. So
sure they do.
The screening. With the time we have left, I want to ask some of the questions that came in from Facebook. And I know that we won't be able to get into them totally in depth, and you do cover some of these in your book. But we already covered one of them, just talking about what to do with making sure we're not calling something perimenopause when something else might be going on. Somebody asked about correlation between low levels of estrogen and affecting cardiovascular health, pelvic floor health, ligament, tendon, joint pain, and insomnia. And you really talked about that some already today and cover that in the book. Do you have anything else that you wanted to cover on that connection between estrogen and health?
Yeah, so we're realizing estrogen affects a lot of body systems, right? I think the hard part is we don't have like at this level, this happens, or at this number, this happens type of thing. And we do tend to give menopausal hormone therapy for particular symptoms at this point, at this current moment in time. It's not recommended that, oh, you should be on menopausal hormone therapy for heart health and prevention. That is not the recommendation, or for prevention of dementia or something like that. That is not the current recommendation. Might that change later? Maybe. I don't know. We need some more testing there before we do that. But certainly it affects a lot. There are also a lot of other things that we can be doing as we know that the estrogen declines over time, and it's gonna, right? Like every woman who has a uterus, who lives long enough in uterus and ovaries is going to go through menopause, right? And so there are lots of other things that hopefully we can start doing in midlife, if we haven't been doing them already, to kind of circumvent those things. So eating healthy, movement is key. Some of those joint and muscle and ligament things, I really hope everyone starts doing some resistance training. I really have not been doing that until the last couple of years. And so it's new for me too. I was kind of off again, on again type of person, but that's huge for maintaining your muscle and bone health. And so there's lots of things that we can do that may or may not be estrogen replacement, as we know those estrogen is going to decline.
Along the lines with estrogen, somebody had asked about some of the options for treating hot flashes. And I know you mentioned hormones. And, this is the thing where there's been kind of a stigma where people will say, well, I know so-and-so and she had breast cancer because she took hormones or whatever. This is like what happened 30, 40 years ago is very different from what we have available to us now. And so currently, it's important for us to ask what we can currently do, not what didn't work or worked for somebody else. So what are some of the things people do for treating hot flashes?
So there is a new medication out that is made just for hot flashes, which is awesome. It was like brand new as I was writing this book. So it was fun to be able to put that in there. Certainly we can just change some environmental things. And those may bring an eye roll a little bit like, oh, okay. But truly like dressing in layers and being able to kind of shed things as you need to. Caffeine is a big trigger. Nicotine can be a trigger, those things that rev us up a little bit. And so I think just being aware of those things, or maybe trying to cut back on caffeine, or if you know you're going into like a meeting or something, maybe don't down your coffee right before that, things like that. But yeah, Bioza is the name of the new medication, which is out just for hot flashes, which is awesome. So if the symptoms are mild, you can try those things first. If you're having, 10 or 12 episodes a day or something, then my goodness, maybe estrogen would be a good option for you. I do want to say that, of course, menopausal hormone therapy and those hormones don't come without risk. But I think we have years ago, even when I was in training, I think we had this exaggerated risk of what it was. And everyone got really scared of hormones. And it was like, oh, I'm not going to do that because I don't want to get breast cancer. So there are certain breast cancers, if you've had that, if you are estrogen receptor positive or something like that, that may exclude you from certain treatments, but not all of them. And so I think it's a good conversation to have with your provider. If you've had breast cancer, it's a good conversation to have with your oncologist, and just kind of look at what your options are. You're not excluded from having help through this time.
Yeah, I know, like for my mom, having gone through a hysterectomy, instant menopause. Yeah. And then because of the cancer history, she could not take the hormones that some of her friends were taking to deal with those hot flashes. So that's why those conversations were really important to have with her provider. And I also know people who have had symptoms that they thought were hot flashes, but they were actually related to like their blood glucose being out of control. And so they were thinking the sweating was related to a hot flash, but it was actually they needed to address something else. So,
or even, high blood pressure sometimes. Like that doesn't feel good when you're running around with high blood pressure. And so, I mean, we got to check it out, I
Right.
think.
Yeah.
Again, that's where that testing comes in. If you're
Exactly.
hyperthyroid, sometimes you'll have that sweaty feeling and feeling hot all the time. So you got to go in and get checked out what it is first.
Yeah. Because we could gaslight ourselves and just say it's just it's a hot flash, and we are ignoring the fact that we have something else we need to check on. Somebody asked, what are some of the best habits to add to your life in this midlife to stay healthy?
Oh, I love that question.
I like that question.
I kind of touched on it just a little minute ago, but yeah, I love that. I think there's lots of things that we can do. And of course, we've heard them all before. I think we've heard them before. And so I don't want anyone to be like, I know, I've been trying to do that, or I don't want to hear that same old thing. Those little things make a difference. So I've been really working on diet for myself, just healthy eating. That doesn't mean you have to cut out entire food groups. I hope you don't cut out entire food groups, but even just being conscious of protein and maybe a fruit or vegetable with every meal. That would improve things a lot. If you just said, okay, what's my fruit or vegetable with breakfast? What's my fruit or vegetable with lunch? And then I just encourage people to be moving every day. Exercise is awesome. You don't have to be doing something strenuous that you hate. You don't have to log hours on the treadmill or something. Go do something that you enjoy. And even 15-minute chunks of time make a big difference for those symptoms, for your weight, for your heart health, for your mental health, for your sleep. So I'm just encouraging everyone to try to get 30 minutes most days of the week and do something that's fun. Go do it with your neighbors. Go for a walk with your neighbors, or something that also you're getting some social connection. And then I've mentioned already weight training, I think, is awesome. However you want to do some resistance training, if it's weights, dumbbells, bands, yoga, any of those things that is helping maintain our muscle mass. We start losing muscle mass in our later 30s even. And so we're just trying to maintain what we've got for the most part. And you've got to do some resistance training for that. And then I have a whole chapter in here on sleep. And so some of the good just sleep practices for making sure that we're setting ourselves up for good sleep. Not sleeping is really hard, and feeling tired all the time is really hard. And those problems with insomnia are hard, but some of it is we're not setting ourselves up for a good night's sleep with, consistent routines and things like that. So sleep is huge. And then I have a whole chapter in social connection. I think talking with others and having a good support system is paramount during this time. And then our preventive health exams and making sure that we have a medical provider that we trust and that we can talk to.
Yeah, and we have permission to switch medical providers if we aren't able 100%. To have those conversations. I think people think they're stuck or their insurance is going to stop them. You are in charge of your healthcare, so you get to choose your provider.
And it is a royal pain. I mean, it's just a pain to have to make an appointment, and then maybe it's not the person you like, or, whatever. It's worth it. It's worth it, though,
it is.
To be somewhere where you feel comfortable and where you feel like you're being listened to. And it's okay to have, also maybe a therapist or someone who's paying attention to those needs that you have, and you shop around for that person a little bit too. So the chapter in there is kind of building a team. And so your providers that you have and your therapist maybe, or other people, they're all members of your team. So it's important to search for the right one for you and then utilize them. Tell them what's going on. Go and see them.
One of the things that you said right off the beginning in the book was you were sharing the story of how your publishers were encouraging you to pitch some things. And you mentioned a comparable book that was out there that you knew you could not realistically give to the people you knew in your practice. What I really like is that whole subtitle of the book, that this is about the body you already have. This is not about you trying to be some fitness guru if that was never part of your life. And so I really like your approach because it's very grounded in something practical. It's like, if my body is this, here's how I keep this body healthy. Here's the relationships that I need in my reality. So I really appreciate that, Mikala.
Yeah, thank you. I saw a quote the other day about something about limitless health. And it just made me laugh because I thought, well, that's not real. So, I mean, there are a lot of things we can control, and there are so many things we can't control. And so this is the body that I get to do life in. And it's going to look like this. It is the age that it is. It has the genetics it has. There are a lot of things that I can't control. And so I like the word agency, but limited agency. We have limited agency. We get to make these choices, but in these bodies that we're living in. And so we're not trying to reach some paramount of, health and whatever, right? Maybe some people are. That is so awesome. If you're an elite athlete, I'm cheering for you. I really am. But my experience in practice in talking with most women is, okay, but that doesn't apply to me necessarily. And what do I do? And how do I keep this body healthy? And so I hope this book is a little bit more for everyone, and that it's a realistic tool, that there are some achievable things in there, sustainable things in there. And I hope that it feels really gentle, that you don't have to feel like, oh, I'm failing. Oh, I'm such a loser, right? I want you to just feel empowered to take care of this body that you've been given.
So before we wrap up, I know we're running really short on time, but I want to ask let's see. I have one more question that I think I'm going to see. Oh, it's a longer question, but I'll just give a summary. So one of my friends wants to know to discuss a little bit how this change affects intimacy. And you really did talk about that change a little bit, but this is a topic that doctors don't often bring up. And I was really fortunate that one of the two doctors I saw did bring that up and discuss it with me, and even had products to recommend before I even asked the question. So if our doctor's not asking the question, what should we do? You talk about this in your book, so I'm going to recommend the book again as a source. But what else can somebody do if they feel like no one's talking to me about this?
Yeah. It's hard to bring that up, right? Why is there so much shame around sex and intimacy? I don't know. It's so, but it is. It's like an ingrained thing in us. Maybe it would help to come with a list of questions where you're asking about this, you're asking about this, and then, oh, can I also ask you about this? And then it doesn't seem like you have to just bring it up out of thin air. I do hope that this book will be kind of a jumping off point, so you could bring it and say, hey, there's a whole chapter on this, and it really got me thinking about sex and some of the issues that I'm having. I didn't even really realize that there were options for me, and could we talk about it? It helps to kind of bring it up that way. Again, my hope is that you'll find a provider who you feel comfortable enough with, that you'll just kind of go there with them. And I'm hopeful that as we have more discussion about women's health, that it's becoming less difficult to bring up, especially if you're going in and saying, I've noticed I'm having a few perimenopausal symptoms. I'm having this and I'm having this. And then I have really noticed some changes with vaginal dryness or something. And, would you think that some topical estrogen would be helpful for me? So maybe lump it into some of the other perimenopausal symptoms, and it'll be easier for you to discuss and bring up.
It goes along with other things that we don't talk about. People don't talk about urinary incontinence very much either. And it's these are just things we're giving permission to talk about these with your medical provider, with your girlfriends. Like, really, let's open up those conversations.
And with your partner.
Yes.
Or the partners that you're with. I mean, it hopefully is something that you can bring up. Like, hey, things are a little bit different for me now. Right. I'm having these issues. I'm having some pain. We got to do something about this or that. And did you even know that there are sex therapists? And so you could dive in and go see someone who specializes in sex. Yes. That's available to you.
That's a good reminder that this is a good discussion to have with our partner, because they are experiencing changes as well. Yeah. And so it's important for us to be open in those conversations. And really, that grows that relationship as well. Open discussion always grows more than, it's not just a physical thing. It really is growing our emotional intimacy to have those conversations as well. So I know it's time to wrap up. So as we look at the book, there are so many topics that you cover here, Mikala, not just physical. You talk about anxiety, depression, mood, stress, that's a big thing. You talk about shame-based health practices, trauma. You have worked with a lot of people who have experienced trauma. You've told your own story about having gone through trauma. And then just remembering yourself. And so I just love how this is a comprehensive way of covering so much that we face in midlife. So the book is coming out on October 8th. Mm-hmm. This episode is dropping a week ahead, and you have some special bonuses that people can get ahead of time. So tell us how they find those. Where do they connect with you?
Sure. So I'm on Facebook and Instagram under Mikala Albertson, MD. On the website, MikalaAlbertsonMD.com, I have my little bonuses that come along with the book. So I put together a downloadable journal for everyone. And in my mind, this is something you could print and put into a binder and take with you to your appointments. I know that we all have like our electronic medical record. I like to have some paper in my hands and a place to jot down notes. And I've got all the information in one place when I go in to see my provider. So I envision people maybe putting some tabs in there, maybe tabs with folders where, you get the little printout whenever you go to the doctor or your physical therapist or whatever. And you could kind of tuck those things away and keep it all together in one place. And it explains, why do we ask about family history? What is a social history when we're asking those questions? So I want it to help guide you through some of your preventive health visits. And then you can take it with you from specialty to specialty too. So you could put a tab in there, if you're seeing a rheumatologist or an endocrinologist, and then you've got it in your hands all in one place. Because I love the electronic medical record. I love that we can access our own. Sometimes it's not the most convenient, and having it right in your hands is best. So that is free to everybody who orders. You can just go, you'll get it emailed to you, and you can download it. And then I have a really fun giveaway over there too. So everyone who enters this gets your freebies, pre-orders the book, and comes to get the freebie can be entered to win. It's got a Lululemon gift card, and it's got a Stanley Cup, and what else is in there? So just some fun little, a little self-care package just for you. So I'll announce the winner of that on October 11th.
Okay. All right. So I'm going to link in the show notes so that you can connect with Mikala as well, in case you didn't catch her website address there. But I really encourage you to get the book, Everything I Wish I Could Tell You About Midlife, A Woman's Guide to Health in the Body You Actually Have. Mikala, thank you so much. I know that I've taken extra of your time, and I so appreciate it because this is such a needed conversation, and I love your approach. So if you have not connected with Mikala on social media, do sign up for her list, because you get so many practical things, and these kinds of things we're discussing now are the kinds of things that you see show up on the posts that she puts out there. So definitely connect with Mikala.
Thank you so much. I feel like I could have talked all day.
I could too. I feel like we just have that kind of connection.
Thanks, Michelle.
If you've enjoyed this topic today and you'd like to hear more like this, please leave comments on the blog post on Substack that goes along with this episode. It's just the show notes. So if you click right in your app where you're listening, it'll take you there to that post. And if you'd like to hear more of these topics, I want to know what you want to hear on Midlife Repurposed. This is a topic that I wanted to cover, and so I was so eager to talk to Mikala, but if you have connections and you have other people who are experts who can have this kind of conversation with me, I would love an introduction. Thanks for tuning in to Midlife Repurposed. Looking for more inspiration and connection? Dive into Midlife Repurposed on Substack, where you'll find resources, weekly reflections, and a community of like-minded women. Visit midliferepurposed.com to join the conversation and keep the journey going.